very special night for those individuals in our community that's dealing with COVID-19, the impact and effects of COVID-19. We're excited tonight. We have experts here. We've got answers to questions that you have been asking that should be asked. And we've got answers that will address your concern. Individuals that actually have studied, have done the research, and actually are dealing with this whole idea called COVID-19. So what we want you to do tonight, please, right now, somebody you know has been asking questions, have not taken the vaccine, and you don't know why, you've been trying to convince them to do so, we need you to text them now, share with them now that the panel is here right now, here at Mount Zion on stage. We have individuals that can speak to your concerns. And as we go through the night on YouTube and Facebook, you can share your concerns, share your questions if they have not been addressed, and we will get it to the appropriate person here on our panel. So what we want to do is disseminate information that is needful and helpful to you so you can make an informed decision, and so individuals in our community can be protected and be healthy. And so we're thankful tonight, first of all, to God. And let's just lift his name in prayer. God, thank you now for this opportunity of providing information and insight through individuals that have been trained, that you've given the knowledge and wisdom to share with our community. Thank you for the expertise that have showed up here tonight. Thank you for the knowledge in which they've gained, the experience that they have in the field of medicine. Lord, we thank you now for a fruitful night. I ask that now that you would touch individuals that are viewing, that we will share this view with others so that we all can be informed in a meaningful way. We honor you now in the name of Jesus. This is thy service prayer. Amen. A few months ago, I called Dr. Cheryl Dixon of WMed, and I shared this idea like we need to get together. We need to get information to our community about COVID-19, about the vaccine, about what's going on, about statistics. And so I want to thank Dr. Cheryl Dixon for pulling together this panel of individuals that will speak to us tonight. So Dr. Dixon, thank you so very much, and I will have opening comments for you now, Dr. Cheryl Dixon.
So thank you, Pastor Moore, and I want to thank the church family and the community for signing in and tuning in and actually watching this broadcast. As you know, we are doing better, and what we want to do is increase the vaccination rate and answer your questions. In particular, now we have the COVID vaccine that can be given to the youth. Pretty soon, we hope to be able to give it to youth under the age of 12. But right now, we are giving the vaccine to adolescents and kids above the age of 12. And so we have pediatricians from the community. We have experts from the health department. We have the Family Health Center, who's actually been out there giving vaccines in the community in partnership with the Mothers of Hope and with other community organizations. And so please, if you have not gotten your vaccine and you have questions, please tune in so that we can answer those questions, because we want our community to be protected. We want you to be safe, and we really want to restore like your health and your wellness and any questions that are out there. And there are a lot of questions out there about the vaccine. So please tune in, and I'm very happy as the Associate Dean for Health Equity and Community Affairs at the medical school to partner with Northside Ministerial Alliance and Mount Zion Baptist Church, Pastor Dr. Moore. Thank you so much.
All right, thank you so much, Dr. Cheryl Dixon. Thank you so much. We're ready to get right into it. And once again, thank all the members of Northside Ministerial Alliance, members of Mount Zion, members of the community now for tuning in for this partnership with WMed. Thank you so very much. We're ready to get right into it, and I think right away we want to start with Dr. Will Nettleton. He's from our health department. And Dr. Nettleton, would you please introduce yourself and share with us the COVID statistics, if you will, in our community, and where are we with the coverage? If you could start with that, Dr. Nettleton.
Great. Well, thank you so much, Pastor Moore. My name is Dr. Will Nettleton. I serve as Medical Director for Kalamazoo County Health Department. I'm also a family doctor and see patients as part of the WMed Family Medicine Residency Program at the Family Health Center, and also see patients in the hospital as well. So right now, in terms of our community, we're doing pretty well. We have about 2 or 3 cases of COVID-19 per 100,000 residents on average over a period of a week. That's about 5 cases per day. That's much improved over where we were in our surge in April, for example, or for example in last winter. So we're doing really well. And that's because I think we're also doing a good job as a community vaccinating our population. 62% of residents in Kalamazoo County above the age of 12 are vaccinated. And with regards to folks who are older, above the age of 65, we approach 80%. So we're doing really well protecting our most vulnerable seniors. But we're here tonight to talk about our youth, particularly those who are 12 to 17 or even up to age 25. For those who are 12 to 17, about 43% of our population in Kalamazoo County have received at least the first dose of the COVID-19 vaccine. And from 17 up to 24, that is still in about the 40th percentile. So actually doing pretty well relative to other counties in the state of Michigan and other places in the United States. But we still got a long way to go. Folks in their 20s, that's where we have a little bit of a smaller coverage rate in Kalamazoo County. So right now, our transmission rate of COVID-19 is low. Our vaccination rate is relatively good, but we still have a ways to go to fully protect our youth and fully protect the rest of the community.
So what's the age group, Dr. Nettleton, that's most being infected right now, as you see it?
There is a distribution among the ages right now. In fact, our seniors are one of our lowest rates, but really those 5 cases that we see come from all per day or so really come from all age groups, evenly distributed. And again, folks who are not vaccinated are the folks who are getting COVID-19. We really don't see folks who are fully vaccinated who end up in the hospital or have severe disease or who actually get infected. The vaccine is safe and effective at preventing that.
Can you say that one more time now? Who's getting most affected now? The people that have not been vaccinated?
That's correct. Those who are not vaccinated for COVID-19 are the folks who continue to be infected and sometimes continue to have those severe consequences.
Okay. Thank you so very much, Dr. Nettleton, and we'll probably come back with you for more questions. But we have actually a youth on our panel right now, Jackson Bergen, and he's a young man that knows something about this vaccine. So Jackson, would you introduce yourself and share something about yourself and this vaccine?
Yeah, my name is Jackson Bergen. I am a 17-year-old senior, or soon-to-be senior, at Loy Norris High School.
So did you get this, have you been vaccinated?
Yeah, I have. It was a pretty smooth and painless process, to be honest. I'm scared of needles, so I know I was trying to hold my mom's hand, but then I realized then it's just a shot, so I just get the shot and get it over with.
So can you tell, why did you decide to get the vaccine?
I decided to get the vaccine because I wanted to have my life back in a sense. I felt like I was pretty limited to where I could go, and I was sick and tired of wearing a mask, so I just felt like getting the vaccine would make it easier.
So how did you feel after getting the vaccine?
A lot of people talked about being sick and feeling ill and stuff like that. I didn't really feel ill, and I know a bunch of my friends didn't either when they got the vaccine, so I'd say there was no really side effects, really.
So what changed for you after you took the vaccine? What changed for you as it relates to activities or the way you felt?
Everything really opened up in a sense. Sports came back completely for us, and we didn't have to wear masks during practice, so you could actually breathe. I could do more stuff with my friends every day. And I can travel to different places now, so that's pretty cool.
So Jackson, what would you say to other young people that's watching that are hesitant about taking the vaccine and for any various reasons? What would you say to them?
I would say just get the vaccine. It's just 2 shots, pretty painless. It doesn't really hurt. And even if you hate needles, just close your eyes, count to 3, do something.
Close your eyes, Count to three. All right, great. I like that. Close your eyes, count to three. Let's continue on our youth track here. Have a representative from KPS, actually Jackson's mom, Nakinga Bergen from KPS. Nakinga, would you please kind of introduce yourself and share?
Oh, yes. Hi, Pastor. Good evening. Nakinga Bergen, Director of Student Services for Kalamazoo Public Schools. Part of the responsibility that we have in student services is regarding health, safety, and welfare for children. And so when you think about the importance of the vaccine, we spent all of last school year virtual, and all of us want to get back to school. It's been, right now we have our summer readiness program operating, and it's been so nice to see our young people back in the building, to have them learning and playing on the playground and engaging. Those are the things that Jackson talked about a little bit that he missed. He missed those opportunities to engage with his friends on the football field and in the classroom. So getting the vaccine is highly important for us to getting back to a sense of normalcy for learning. And I say a sense of normalcy because we will wear masks for the first trimester as a school district. That is something that we have committed to, primarily because our students younger than 12 haven't been vaccinated yet. And we want to ensure that our school community will be safe and cared for, and that our teachers will be safe, and our students will be safe, et cetera. So getting the vaccine is so very important for us to get back to face-to-face learning, to get back to those social opportunities that young folks have, to getting back to some of the social activities that we do in the school day that promote social-emotional learning, so that our kids are confident as they are engaging with other people. Look, I'm getting ready to send my youngest to college in a year or two, or a year, oh gosh. And, and I want to make sure he's safe. And it starts with this vaccine. It starts with ensuring that he is protected from COVID-19 and ensuring that when he goes away to school, he won't have to focus on, am I around someone that hasn't taken the vaccine? He will know that he is safe. And so that's really what we encourage from the school district standpoint. The health, safety, and welfare of kids right now, the focus starts with that COVID-19 vaccine.
So, Nakinga, and we asked everybody to speak right into the mic. I got a message for someone online, hard hearing, and so we want everybody to just speak right in. Just go ahead and eat the mic. Don't eat it, but get close enough so the folk can. Don't worry about. So we want the online audience to hear. So we got the comment. We're ready. So, Nakinga, are there different options now for the fall as far as reopening with children in school?
Absolutely. We understand that some families are still apprehensive about sending their children to school. And so there is a virtual option that's been made available for our families. And they had the opportunity to opt into that option earlier this spring, or actually late spring, early summer. However, we will also have the face-to-face option available, and that's really the go-to. We really want everyone back face-to-face. However, we understand that there are some families that need the virtual option.
So what's the recommendation from KPS for parents, Nakinga, for their children who are underage for vaccine?
Yeah, so we really want them, again, daily to do screening. So even our kids that are in summer readiness, we're asking the parents every day, screen your students, check for fever, the guidance that we've received from the health department, making sure that they're not over 104, I believe, ensuring that they don't have any new cough or sneezing or any of those kinds of body aches. There's a list of symptoms that we ask parents to check daily. Check them before they get on the bus. Ensure that they have a mask. If they have a reusable mask, that they wash it every day. And if that's not possible, we have plenty of masks at school in the district and on the buses, so that when children board the bus, they can get a new mask. When they get off the bus, they can get a new mask walking into the building. But we want parents under the age of 12, or with kids under the age of 12, to ensure that they do that daily screening, that you keep your students home if they are not feeling well, or if you know they've been exposed to someone with COVID-19, please keep them home so that we can keep the rest of the students and staff safe. And then when they are symptom-free and they followed all of the COVID requirements, they are free to return to the learning environment.
Okay, one more question, Nikki, and then I'm going to leave you alone for a while and pick on somebody else. So what's the recommendation for children between 12 and 18 that are eligible for vaccines?
Go get the vaccine. The recommendation is you want to be back in school, even if you don't want to be back in school, you know you're coming back to school. So get the vaccine. It's important to just go ahead and really walk it through with someone who's already done it. There are, as my son pointed out, there are a number of young people who have taken the shot. Talk to them and get their feedback, and understand that as parents, your young people really, really love to have that personal interaction, and they can do that safely once they've been vaccinated.
Now, once again, to our audience, we've got individuals here that can answer your question. So I don't see any questions right now, but make sure you ask your question, because you've been asking them to certain people, and you've been making statements as if, you know, you've got the information. So just in case your information is a little off, just in case you're not exactly right, we've got individuals in this room tonight that will answer your question. We guarantee you, we promise you'll get an answer. So any question at all concerning this vaccine and what's going on with COVID-19, please put those in the chat and we will ask them. Our next person we want to talk to is Dr. Sylvia Fox. And Dr. Fox, please share with us who you are and what's Bronson doing to disseminate information about this vaccine and get our community vaccinated. Dr. Fox.
Hello, I'm Dr. Sylvia Hicks Fox, and I am a pediatrician at Ascension Medical Group, Bright Futures Pediatrics, and we're associated with Borges Hospital. I recommend that all of my patients 12 years and older receive the COVID-19 vaccine. And I'm proud to say that many have already done that when I see them for their routine exams this summer. I believe the vaccine is safe and it's effective. In fact, in the clinical trials with children 12 to 17, it was 100% effective. That's under experimental conditions, but it was 100% effective. So we know that it is effective. I also encourage the parents that come in with the children to get the vaccine as well. I know that some people have been concerned about potential side effects of the vaccine, one of which is something called myocarditis, pericarditis, but those events are very rare, and most individuals who are infected or develop those symptoms recover fully. So there's really no reason not to get the vaccine.
Now, Dr. Fox, I think I gave you the wrong hospital, because I said
Yes.
Bronson and then
Yes,
you
you
said
did.
Ascension. So it
Yes.
makes me think that I gave the wrong hospital. So I'm going to give you the right hospital, Ascension. And so, because I realized when I said that, and then you said something different, I'm like, okay, we got two different hospitals here. So forgive me for giving you the wrong hospital. But we do have Bronson in the house, but this is Ascension. So Dr. Fox, what would you say to parents now, the COVID-19, what would you say to those parents that have children that have not been vaccinated and they are not vaccinated? What would you say to those?
I would ask the parents why they are hesitant to get the vaccine, to try to help them understand and explain to them any concerns that they might have. I would give them the scientific information about how effective the vaccine is and how it will not only protect them as an individual, but it protects other family members, it protects others around them who may be vulnerable and are unable to get the vaccine, and it also affects our community as a whole. Children have not had as many severe infections from the COVID as adults. However, they can still get infected, they can get very sick, and some have died from it, unfortunately. So I encourage them to look at the scientific information and to reconsider their decision and to get the vaccine.
Now, Dr. Fox, thank you for that, because that's one of my concerns, particularly as pastor, that pastors individuals with children. That's one of my concerns. How do we protect our children that are not eligible to get vaccinated? What's the best way for parents? You may have answered, but can you go over that again? What's the best way for parents to protect our children that are not eligible for vaccination yet?
Yes, so if your child is not eligible for the vaccination because of age, the recommendation is if they're 2 years and older to wear a mask to protect them. Some just ordinary things that you would do to help prevent infection include avoiding touching your eyes, your nose, your mouth, washing your hands for 20 seconds. If you sing happy birthday twice, that should get you to the 20-second mark. Just general good health in terms of exercise, drinking plenty of fluids, getting adequate rest, eating a healthy diet. You should also avoid crowded places that don't have good ventilation, because that may place you at risk as well. So just taking all of those precautions to keep your young child safe if they're not eligible for the vaccine.
Right, thank you. Now, you said something when you were talking that I hear a lot, individuals say that they want to do the research and check the science. So for the average person, what does that mean? You know, what are they checking? And what's the science? I mean, how does a non-science person check science? So, because I hear people say that all the time. So, maybe you can help me, or somebody can help me with that. Because individuals are like, I got to check the science. Not enough research has been done. It's still a experimental drug. So, can you speak to that?
Yes, so the science involves how the vaccine was developed. It involves what were the trials, what did the investigators look at when they gave the children the vaccines in the trial studies, what side effects developed as a result of the vaccine, and did it work? Did it prevent children from getting COVID-19? So that's the science behind it, and I would encourage people to talk to their physician, their pediatrician, if they have questions about that.
And that's what I'll do. I'm going to talk to people that know what they're talking about. Because all the stuff you just said, if I did that, I wouldn't really understand that. So,
Right.
But, I mean, if you're out there and you're going to do that, make sure you do that. Dr. Carolyn Watley, welcome to Kalamazoo. Would you please share? Now, you from Family Health Center, right?
Yes.
I don't want to get another one wrong. Come on.
Yes, hello, I'm Dr. Carolyn Watley. I'm the Chief Medical Officer at the Family Health Center. Thank you to Dr. Dixon and the Mount Zion Church for inviting me here. You know, at the Family Health Center, from the beginning, as soon as the vaccines were available, we have been out in the community and had the privilege to collaborate with wonderful community partners and have hosted large events, small events. For us, it was important that we meet people. We want our patients to have access to the vaccine. We understand the science. We know that the vaccine is the only way to stop the spread. And we know it's important for our patients to have providers who can understand, who can explain. So at all our events, our providers were there to answer questions. And we have prepared literature that kind of addresses the questions in a way that our patients can understand. And I'm excited that we have vaccinated over 10,000. We've administered over 10,000 COVID-19 vaccines with our community partners, so that was a real important landmark for us. And as of this week, we are actually offering all the vaccines in both our clinics every day. So I encourage everyone to come in. We have our providers there willing to and able to answer questions. I have 2 teenagers, and my daughter was 19. She got vaccinated, you know, when she was able. And then when my son was able, he was 15. He did not want to get vaccinated because it was, Mom, I just don't want to feel sick today. And I encouraged him. I said, son, do you know what I do? I encourage people to get vaccinated. There's no option. And he actually realized that he didn't have any side effects. I think he was more concerned about the side effects. And so I'm very pleased that he was actually vaccinated at one of the Family Health Center events. So, so I encourage everyone, if you have questions, just come into the center. We're able to answer your questions. We have the vaccines available, and we want you to get vaccinated.
Great. Make sure, once again, I got questions coming in, so I'm going to throw these questions out, and so whoever feels like this is yours, go get it. Will we have to be vaccinated yearly? That's a question that we've got. Will we, Dr. Nelson?
That's a really good question, and scientists are still investigating that question. But right now, there is no recommendation for that so-called booster shot. Today, however, a panel which is known as ACIP, the Advisory Committee on Immunization Practices, it's made up of doctors and scientists, started looking at the data more closely about those who have decreased immune systems and perhaps the need for a booster shot. No determination yet, but this is what scientists do. We look at the data, do more studies, and then when we have more information, the recommendations will change. There are more studies that will be coming out in the fall and the winter as we learn more about our immune systems and about how the vaccines work and how long they work for, and recommendations may change at that time. But right now, as of today, there's no recommendation for a booster shot yet.
All right. And Dr. Watley, this sounds like a question for you. How do you help someone who won't get the vaccine because they don't want to? How do you help them? And how can you talk someone into getting the COVID-19 vaccine?
And I think that's why we're so excited to offer the vaccines in our clinics, because a lot of our patients have that relationship with our providers. They know the provider, they trust the provider, and actually it's coming into the clinic, asking your questions, and just being open to the answers.
All right. Here's the next one, because they're flooding in. It is documented on the CDC website that this vaccine could cause death. Is this true or false?
I can take that question. And so that is a myth, that the vaccine causes someone to get COVID-19 or causes someone to die from COVID-19 disease. There's something called a surveillance system, where we look at how people do after they receive the vaccine. We do this for all types of vaccines, all types of medicines. You can think about it as a big vacuum. We want to know all the information out there, and then scientists and doctors look at the information to see if there is a correlation, and if so, to make an updated recommendation. And so that's what we've done with regards to new information about whether it's heart inflammation, whether it's nerve inflammation that occur, or blood clots, depending upon which vaccine we are talking about, that occur in very rare cases. And when that information is reviewed, a further risk assessment's done, and we make a different recommendation. But all of the vaccines right now, the Pfizer, the Moderna, and the Johnson & Johnson vaccine, are safe and are effective and have been evaluated very rigorously, very thoroughly along all steps of the way. So a person cannot contract the virus that causes COVID-19 or die from get COVID-19 from the vaccine itself. In extremely rare cases, there have been a death associated with the Johnson & Johnson vaccine with looking at that severe blood clots. So if I could take a minute to talk about that, because I think there was a lot of confusion about what that pause was all about a few months ago in April. What was that all about? Well, that surveillance system, looking at the data, we were actually able to pick up what's known as a signal, saying, hey, there may be something here. And hey, look, there may be some severe blood clots associated with that Johnson & Johnson vaccine. And it was looked at and seemed to be related to about 7 cases out of 1 million, and may have been associated with women who were on the younger of age, between 18 or 49. So then that pause happened. So scientists could look into information even more. And it was also communicated to doctors. Because normally when doctors treat blood clots, we give a blood thinner. But we actually had to do something differently for this type of blood clot and use a different type of medicine. So the system worked, identified something that was very rare. There was a pause. Doctors had information communicated. And then the scientists and doctors, again, looked at the data and said, you know what, on a whole, looking at persons individually and persons as a population, the benefit of that vaccine far outweighed the risks. So the outcome of that pause, specifically for the Johnson & Johnson vaccine, was for women of reproductive age, 18 to 49, to be aware of that risk, but they still may receive that vaccine. So that's an example of this idea of looking at the data, looking at what their surveillance systems does, and then making an adjustment and a recommendations and to communicate for people to make that decision. I hope that helps.
All right. The chat is heating up. Here's another question. Apparently, vaccinated people are getting COVID. Is that true or false? Doctors?
Yes, that has happened, breakthrough infections. If you have the vaccine and do get COVID-19, it will be a very, very mild case, and it's very unlikely that you could transmit the virus to other individuals.
All right.
And that's very rare that happens. And that key point is that those folks don't end up in the hospital, and those folks rarely end up dying. And that's what we want vaccines to do.
Keep people from dying. Yeah.
And out of the hospital.
Yeah, because is Johnson & Johnson vaccine safe?
Yes, Johnson & Johnson vaccine is safe and effective at preventing COVID-19. And it's folks being aware of those very rare blood clots that occur. And it's very hard when we communicate this type of risk. Those powerful stories that we hear about are much easier to communicate than wrapping our heads around what a million looks like. You know, what actually does million look like overall? And so the answer to that question is yes, and folks should be aware of that small risk. And that the fact that the risk for COVID-19 far outweighs the risk of the vaccine.
Okay, I got 3 questions. I'm going to clean up, and we've got other panelists going to shift. We're going to shift and pick up other panelists, and I got a co-host out there waiting in the wings. So here's the next one. Should vaccinated people still wear masks in crowded areas, such as supermarkets, for example?
I would say yes, because of the rise of the Delta variant, which is more contagious, because you cannot tell who's vaccinated, that it is safe to protect yourself and to wear a mask in crowded areas.
One other context that I would mention too is looking at what our community rates are doing. Right now, in Kalamazoo County, the rate of transmission of COVID-19 is very low compared to other parts of the country, for example, the southern United States, Missouri, Arkansas, Louisiana. So our risk is very low as a community right now, as a population. Then it's thinking about what your individual risk is. If you have cancer and you're on, chemotherapy, that is a good reason to continue to wear a mask around others or in a crowded place. But a key point that I want folks, some listeners to hear, is that the vaccines continue to be effective against the Delta variant. The Pfizer vaccine, the Moderna vaccine in particular, and also true for Johnson & Johnson with small studies. So the vaccines that we have available to us continue to be safe and effective against that Delta variant.
Okay. Boy, the questions are flooding in. Okay, here's the next one. What is the prevalence of the variant in our area? There seems to be a lot of breakthrough cases for fully vaccinated people. Is that the case in West Michigan, the Delta variant?
We've only detected 1 case of the Delta variant in Kalamazoo County. The surveillance of looking for that particular type of variants or variants in general depend on what's sent to a special laboratory to have that done. And Michigan actually does a lot more testing for variants than most other states. Right now, in the United States, the predominant strain or predominant variant is the Delta variant now. It's about 60% of cases in the United States. And just a key point about maybe what a variant is, this is what we expect viruses to do. They change over time. And this whole idea of a variant of concern, what that means is, hey, there may be potential for certain strains to be more transmissible, meaning spread more easily, or more severe disease overall. And that's why it's so important to get vaccinated. The less opportunity the virus has to be in other people, the less opportunity it has to mutate and change over time. So more people we vaccinate, the better we can protect our entire community and better protect those who have yet to be vaccinated, such as our youth.
All right, listen, can we share just one other statement from each of you, what you would say to our audience before we shift panels and get the rest of our panelists up here, because we want individuals to hear from all individuals that have something to say concerning this COVID-19. So any other thing, Dr. Watley, you would like to share with our audience?
I would like them to know that the vaccines are safe and that it's the best way we have to stop the spread of the virus and to be back to life as normal.
Dr. Fox.
Yes, and I would agree with that. A shot is just a shot. Kids are used to getting shots. They get them starting at 2 months of age. And I do tell my patients who come in with tattoos or a lot of piercings, if you can go through that, you can get a little shot. So get the vaccine.
Okay.
Yeah, I would just say our kids deserve an opportunity to have face-to-face learning. And so parents, please ensure that your students, your young people get the vaccine so that they're able to return to face-to-face instruction. And those that aren't yet quite at the age to get the vaccine, continue to wear your mask, continue to wash your face, or excuse me, wash your face, but wash your hands. And then also make sure that you are limiting those large crowd events, because we really want our students to be back face-to-face in the fall. We've taken every precaution in the district down to ensuring that our buildings have bipolar ionization to allow for fresh air to come in the building. So we've taken every precaution throughout the district, even on our buses. So we're ready for them. We just need them to be vaccinated.
Jackson.
Okay. All I gotta say is I know your kids miss the interactions that they make in school, and I know that some of them probably learn better in a school setting, you know, like sitting at a desk. So why not just get them vaccinated so they can return back to school and make new friends, just live life normal again.
All right, Dr. Nevis.
I think it's okay to have questions. It's okay to be skeptical or have hesitancy. That's completely normal. And I think a key point that Pastor Moore brought up was, you know, when we have so many sources of information and so much misinformation, you know, where do we go to find correct, accurate, scientific, trustworthy information? And as Dr. Watley has mentioned, Dr. Sylvia Fox, talking to your pediatrician, talking to your family doctor, talking to your friends, going to the Centers for Disease Control's website, going to the Kalamazoo County Health Department website, and your local family health center and hospital websites for accurate information. Those are trustworthy sites and persons for information for you and your family.
Awesome. Thank you so very much. Those that have submitted questions, we're going to cover these questions in our next segment, but we're getting ready to shift our panel now because I'm watching the clock. And so what I'm going to do, I'm going to have the camera just watch me. I'm going to talk for a minute while the panelists go out, because I don't want you to see the panelists go out and the new panelists come in. So I'm going to talk for a while they're exchanging, and then I'm going to shift it over to Dr. Cheryl Dickerson, and she's going to talk for a while until everybody's in place. And by the time you see the stage again, we're going to have a co-host here with me, and we're going to have other panelists. So right now, we'll continue to make sure you ask questions, put questions. I got about 6 questions right now on, thank you very much, Reverend Moore Brooks. I got 6 questions that we've got to cover in this segment. And then we need you to share. Make sure you share. Make sure you call somebody, you text somebody, get in touch with somebody while we're shifting panelists. Like, this is great. I need you on. You've asked questions, and so I need those. You can answer those. Dr. Dixon.
I want to thank the panelists that were here already. And we have another group of panelists that include pediatricians and representatives from Bronson Hospital, We have Stephanie Williams, who's actually going to be answering, asking questions like Pastor Moore was. And so please stay tuned. We have the Chief Executive Officer for the Family Health Center and a pediatrician from the Family Health Center as well. So thank you for your questions. Your questions are important to ask. This is the time to ask those questions, because what we want is for you to have the right information so you can make what we call an informed choice for yourself and for your children in taking the COVID vaccine.
You got the questions.
So I think we're almost ready. We just have one more panelist is coming back up. And just give us a few minutes, but continue to send in your questions, because this is really that time for the community. This is for you. We are doing this so that you can ask those questions. We talk about scientific evidence, we talk about research, but this is a time for us to stop the doctor talk and really explain it to you in ways that you can understand, so that, again, you have the right information, answered your questions, to be able to make the informed choice for your family to get this vaccine, because we want you all to be safe.
Thank you, Dr. Dixon. We ready now, and just like we've said, voila, there's a different panel here. There's one with a different seat, and you didn't get to see anything. It was all done, and you don't know how it's done, but we did it. And so we're here now, and I've got a co-host with me in this segment, Stephanie Williams from Mothers of Hope, that's involved in this community as far as getting this vaccine out and educating people. So thank you, Stephanie, for joining us, and I'm going to let you take the lead, and I'm going to handle the questions. Stephanie Williams.
Well, thank you, Dr. Moore, and good evening to everyone joining us online. We're going to finish strong. I have an amazing panel of individuals. I want to start with Dr. Kathy Jackson. If you would please introduce yourself, talk about your role, and we're going to jump right in.
Good evening, everyone. Thank you, Pastor Moore, for allowing us to use your facility. Thank you, Dr. Dixon, for putting this together again. I'm Kathy Jackson. I'm a pediatrician at Family Health Center. I've had the privilege of taking care of families and children over the last time frame. I'm glad to be here tonight. I just want to be able to help people understand the importance of getting this, and as many people have already said, so we can return to some sense of normalcy. So glad to be here tonight and excited to share in the information that's going to be disseminated.
So, Dr. Jackson, in your role at Family Health Center, being a pediatrician and seeing and touching and taking care of the children, can you talk a little bit about any side effects that you've seen in our children as they've been receiving the vaccine, if any?
So we are able to, this week actually we've started in the office exam, or I'm sorry. Okay, all right. In the office vaccines, and I've had the privilege of watching the kids actually getting them, as well as doing the observation 15 minutes after. The biggest complaint a day or two later has been the actual soreness of the arm. Sometimes kids have complained of headaches or even chills. The actual process, as you heard Jackson say earlier, is relatively painless, the actual process of getting the vaccine, but there are some potential mild side effects which are much less than the effects that you would have if your child had the virus and ended up hospitalized.
Are there some specific things, signs, or symptoms that parents should look for after their child is vaccinated?
Sometimes the child may feel tired after a day or so later. Sometimes they have headache. Sometimes there's chills or muscle aches. Those are the biggest things that I've had parents complain about, as well as the literature does say that may occur as well.
Thank you. So with us this evening, Dr. Moore, is also Dr. Erin Lane Davies. So if you want to introduce yourself and talk about a little bit of your expertise in terms of the COVID-19 vaccine.
Good evening. I'm Dr. Erin Lane Davies. I'm a pediatrician with Bronson Healthcare Group. I serve as the Chief of Quality for our medical group and also have the pleasure of serving on the Board of Directors at Family Health Center.
So, Dr. Davies, how is Bronson helping to disseminate the vaccine throughout the Kalamazoo community?
So Bronson has really attempted to meet the community in the most effective way, and so that's included a number of initiatives of large volume sites where we're vaccinating hundreds of people a day. That's been in partnerships with community organizations, including Family Health Center, but really organizations, including churches, community groups all across Southwest Michigan. And that's been, as few as 50 people and as many as 1,000 people in a day. So it's really coming to our community and meeting that need in the way that the community asks us to.
Absolutely. And speaking of community, we have with us the president and CEO of the Family Health Center, who, Dr. Moore, I happen to know have been on the front line engaging the community right there in the heart of the community, touching some of the most vulnerable folks. And that is Denise Crawford. So Denise, introduce yourself and talk a little bit about some of the outreach that Family Health Center has been doing.
Thank you. Thank you so much, Stephanie, as well as Pastor Moore, and just thank you for allowing this opportunity. As indicated, my name is Denise Crawford, and I have the pleasure of serving as the president and CEO of Family Health Center over the past 11 years and throughout this pandemic. But with Family Health Center, it has been so critical that we were able to meet the needs of all individuals within our community, particularly with the testing and then ensuring that they had access to the vaccine. So I'm extremely proud of all of the providers, the partnerships that we've been able to make, and really just the community coming together to ensure that individuals had access to this vaccine.
Awesome. So we get a lot of feedback out there on the front line, Denise. Talk a little bit about why it's important for the children as well as the families to be vaccinated. They're going to the grocery store, to the doctor. They're doing so much in the community. Talk about why it's important that everybody, the family, is vaccinated.
Absolutely. And so I think, to sum it up as best, you've heard from numerous medical experts this evening, but the reality is that we are trying to prevent death. We know that the COVID-19 virus has killed numerous individuals. I believe the last number was over 600,000 individuals across this country. We also know that it was disproportionately affected in those with brown and black skin. As a result of that, it is so important. This is the only mechanism that we have today to prevent death. So in addition to the ability to slow the variants and to stop and allow us to get back to some level of normalcy, what's most important, and the reason that we are out on the front lines with Mothers of Hope, Bronson Healthcare, WMed, all of our partners, is because we care and we are trying to protect you and your babies from dying.
So Denise, what is the Family Health Center? As you look at the Family Health Center, how are you getting individuals ready for school? What's the Family Health Center's plan for getting individuals go back to school?
Excellent, great question. So one of the key events, and again, Family Health Center has been out, boots on the ground, an average of 3 to 4 days every week, again, with our partners, Mothers of Hope, Bronson, et cetera. But one of the things that the community is very much, very appreciative of over the years has been the back to school bash. And so we have made the decision, because of the importance of this vaccine, as well as other immunizations. We are continuing and we are bringing back the Family Health Center Back to School Bash. So that will be this year, August 20th, from 10 a.m. to 6 p.m. We will have the full onslaught of rides, petting zoos, school supplies, hygiene kits, etc. We have purposely redesigned the bash so that it can be safe, so that we can social distance, so that we can sanitize, and so that we can keep you and your children and family members safe. But more importantly, we will be offering the COVID-19 vaccine to all members at the annual Back to School Bash this year.
So amazing. You are just doing phenomenal work, Denise, and we truly appreciate you. Dr. Jackson, there's a question on the line. Can someone explain why they do not test the patients for COVID even though they've been vaccinated? Is that a way to get a true way to see if the vaccine works if they don't collect the true data? So you're already vaccinated, you go to the doctor, should they be tested for COVID-19 anyways?
No, we are not testing at that point most of the patients unless there's some severe reaction or symptom that would maybe cause them to be hospitalized. But generally in the outpatient, if they've had the vaccine but you still have some symptoms, we are not testing. What we will tell you to do is go home and isolate and then hydrate and wash hands and all that good stuff. We will do close follow-up as well with phone calls to make sure that the patient is improving. Generally, we are not retesting testing if they've been vaccinated. Again, we will just do close follow-up and then also monitor and send them where they need to go if symptoms worsen.
So,
Why that you're not testing is because you believe in the vaccine, that the vaccine is working?
Yes.
Is that one reason?
Yes, yes,
Okay.
and the symptoms should not be as significant either with the vaccine.
Okay.
So in a follow-up question to that, someone has commented, I got the vaccine and I'm experiencing chills and slight coughing. What should I do since there's no booster shot yet?
You're still gonna just isolate yourself and stay home and hydrate and wash and bleach down everything because you still may be coming in contact with people who have not been vaccinated. You may have family members in the household who are too young to get vaccinated. We're just gonna still take the same precautions. No, there's not a booster, as has been mentioned earlier, but we still wanna be wise. So if you have symptoms, and it may not be that. You may have some other infection that you don't want to pass to another family member. So still use common sense with this. There are symptoms that are related to this and symptoms that may not be, but you don't know. Be wise, stay home, and protect yourself and protect others.
Absolutely. So Dr. Davies, another question is, so after all of this, I still choose to rely on my natural immunity and I take the clot shot. Would you segregate me and my family?
So we know that the vaccine is the way for particularly people who are vulnerable, and so people who are on medications because they have heart disease or they've had a stroke, those would be the common reasons that people are on blood thinners. Those people are at particular risk for having severe disease from COVID, and so that's a really good example of someone who really should get the shot so that they can protect themselves, and would encourage that the people around them, that person's family, to take the vaccination so that they can help protect their loved one as well.
Dr. Nettleton, often in the community, I get the question, if I have multiple sclerosis, if I have diabetes, if I have some other type of chronic disease, should I take the vaccine? Should they?
Absolutely. Those medical conditions increase your risk for having complications to COVID-19. The majority of the patients I took care of in the hospital had those underlying medical conditions, had conditions like diabetes, or had lung disease, or had heart disease, and they're the ones that ended up on oxygen or in the ICU. So that's a clear reason to get vaccinated. I want to take a moment to clarify one other point too about what I often hear in the community is, isn't this an experimental vaccine, and did they do the testing right overall? I think there's a misunderstanding there when I hear that this is an experimental vaccine. The experiment happened in the studies that were done, when tens of thousands of people got the vaccine, tens of thousands of people didn't get the vaccine, and we looked to see if did that prevent hospitalization, death, and the infection. And the profound answer to that question was yes, that this vaccine works. And for kids, we looked at thousands of kids who got the vaccine, didn't get the Pfizer vaccine, and then looked at did they get infection or not. And the profound answer to that question was also yes, the vaccine is safe and highly effective at preventing infection. So I just wanted to clarify that this is not an experimental vaccine, and now it's been received by millions of people around the world, and we know it works.
I want to jump back to both Denise and to Dr. Jackson, because one of the things I get in the community is, I had COVID, I survived, do I really need this vaccine? Since you are, especially at the Family Health Center, seeing so many people, particularly from the urban community, people with some of the greatest disparities, talk to us a little bit or answer that question for them. I survived it, do I still really need the vaccine? Denise?
Absolutely, thank you. So, again, as indicated by the medical professionals tonight, you absolutely need the vaccine. It's not uncommon that we do have a group of individuals, thank goodness, that have contracted COVID-19 and continue to, go on with their lives. They have the discomfort 14 days oftentimes, and they, quote unquote, are able to recover and, go on and continue normal lives. Those are the very positive stories. And I would invite some of the physicians, particularly the inpatient physicians, to elaborate after this. But what I will tell you is that the stories that oftentimes you're not hearing is the individuals who contract COVID-19. Fortunately, they do live, but their lives and their health conditions are changed forever. And so because of that, again, the safest method that we have, the only method that we have to prevent the symptoms, to prevent COVID-19, most importantly, to prevent death, is the vaccination. But again, I would turn it over to Dr. Lane Davies, again, Chief of Quality at Bronson Healthcare, who spends quite a bit of time with this and perhaps can elaborate on those individuals who contract COVID-19 and don't necessarily fully recover.
So I think one of the most striking things is the number of people that we've seen hospitalized and die since we had the opportunity to protect ourselves. And the vaccine has been tremendously effective in the studies as we look across the country and right here in our community at preventing both hospitalizations and death. As it relates to death in our community here in Kalamazoo, you are 60 times more likely to die if you're unvaccinated from COVID than if you've been vaccinated. So it is a powerful tool to protect yourself and for those, again, who are around people who are vulnerable to, if you take the vaccine to protect your loved ones. So 60 times more likely to die if you've not been vaccinated.
Thank you, Dr. Davies. I do want to, Dr. Jackson, if you wanted to jump in there before I go to my next question, since Denise rerouted us.
Thank you. Even on a practical sense, think about it. We don't know if you've had the virus, you don't know how well your body has built up an immune response. So the vaccine can be like your booster, for lack of a better description, and give you that extra bit of coverage that you may need. So yes, you may have had the virus, but yes, you still need to get the vaccine because you don't know how well your body has responded. So,
absolutely. As a COVID-19 survivor and having some lingering effects, I know that it could really tear you up. We talked a little bit earlier about young people and this virus and the vaccine. And so we have some questions in the chat, and so I want to jump back over to Jackson and ask you, Jackson, from your perspective, are youth in our high school community hesitant about getting the vaccine? And if so, why do you think that is?
I would say some are, but at the same time, some aren't. The ones who are, I think the reason that they're so hesitant is because they're just, for one, they hate needles or something like that. Or it's just like they don't want to feel sick. They don't want to get sick because they're on edge about COVID. And some people just don't even want to go outside. I think that's the main reason why they still don't trust everybody, and they still mask up and really go anywhere. So I feel like that's one of the main reasons why.
Absolutely. And Dr. Davies, just to jump back over to you again, we get a lot of questions about the safety of the vaccine. And we've heard from every panelist up here, take the vaccine, that is the recommendation. But there's also been questions, whether if it was about Johnson & Johnson, even Moderna or Pfizer. Can you just elaborate on the effectiveness of the vaccine and why you as a doctor saying, yes, do this, it's necessary?
So really, it's about understanding what's your risk. And so we all take risks every day. When I get in the car and I drive to work, there's a risk I'm going to get in a car accident. But the benefit of me having a car and being able to drive, outweighs the risk of me walking to, Chicago or Detroit or something. And there's tremendous benefit in me having that tool. And the vaccine is a powerful tool, and it dramatically decreases our risk. And so when we think about the vaccine in children, there's a small risk of some of the medical conditions like inflammation around the heart from the vaccine, but those cases are extremely rare. And as a pediatrician in this community who takes care of children in the hospital, I've taken care of a number of children who've had heart inflammation, not because of the vaccine, but because of the virus itself. And so we know that the virus can have, while generally mild for children, can have very serious effects. And I've taken care of many of those children here in our community who had very serious disease from COVID or the aftermath of it.
Absolutely. Another question is about Dr. Davies, is about the new variant that's out there. How concerned are you about that new variant, and what should our community do?
So we're seeing that the Delta variant in particular is being very hard on communities, particularly on communities with low vaccination rate. As Dr. Nettleton mentioned, here in Michigan, here in Kalamazoo, we've not seen very much of that, and that's because of all the good work that we've done together in ensuring that we're protecting ourselves and protecting our community. I have concerns as we get back to our normal lives. For people who are not vaccinated, they are at high risk of contracting the Delta variant of COVID and all of the disease that can come with that.
I want to go back to you, Denise. There's a question in the chat that said that they saw on the news that some people that are getting, I'm sorry. The question is it true that there are efforts trying to pay people to get the shot and then they end up getting COVID? And Denise, I want to ask you this, as well as Dr. Davies on behalf of Family Health Center, and then again on Bronson, because I know there are a lot of community-based efforts that are happening that are being very creative and outside of the box to make sure that people have access to the vaccine and have every opportunity to be able to get it. Not that people are being paid to do something. So I just want to have you help me put some clarity on some of that outreach, and maybe what are some of those incentives or what are some of those creative ways to get people into safe spaces to be able to access the vaccine?
Absolutely. So to your point, no, I do not believe, and I have not heard of any particular situation where people are being paid to take the vaccine. However, because of the importance of the vaccine and the fact that it takes all of us in order to reach the herd immunity, in order for us to be able to get back to this normalcy, it's not just enough that I've been fully vaccinated or my mother's been fully vaccinated, my husband, et cetera. It takes an entire community. And so as a result of that, we have been providing incentives to individuals to take the vaccine. And with that, the whole purpose is an opportunity to protect all of us. So we do incentivize you. Many people do not necessarily have strong convictions. People have said things that it's not convenient, I don't think I need it, it's not for me, et cetera, et cetera. And so with those, then we do provide incentives, and we have seen that a large aspect of the community has shifted, again, in order to provide that encouragement, that perhaps if the drive is uncomfortable, you will drive for it. We have found a lot of people are willing to submit to the inconvenience for a large flat screen TV. Many people are willing to adapt to the inconvenience or perhaps the fear of a needle for, Beats headphones, et cetera. So whereas we're very respectful, and similarly with the entire state and the governor introducing the lottery, again, the whole purpose is to protect all of us so that we can start to get back to some form of normal within our state and our country as a whole.
And before I go to you, Dr. Davies, I just want to say thank you to you, Denise, because you're doing a phenomenal job out there in the community, very hands-on, touching folks, partnering with organizations like the Northside Ministerial Alliance, with Mothers of Hope, even with the respecting hospitals as well, making sure that everyone has access and opportunities. So tip my hat to you, Queen. Thank you. Dr. Davies, I know that Bronson is in the trenches as well. You're doing your very best to reach and touch and engage individuals. Do you want to talk a little bit about some of the ways or maybe incentives that the hospital is doing as well to provide the vaccine to everyone?
Yeah, so fundamentally, our mission is to help us have a healthy community. And again, the vaccine is a safe and effective way of doing that. And so anything that we can do to make it easy for people to get the vaccine, that's coming to where you are in the community, that's making ourselves available through community panels like this, and if there's a need for transportation or somebody can't leave their home because they're homebound, then we're going to make every effort to take that vaccine to them in an effort to protect our community.
So one or two last questions here. I'm going to shift over here to you, Dr. Nettleton. So some folks are saying that they saw in the news that some people that are fully vaccinated are still getting the COVID symptoms. Why is that? I know we touched on that a little bit earlier, but why is that?
Well, just to clarify about what those symptoms are, we do expect those side effects after you get the vaccine. The first couple days, you may get that headache, feeling run down, feeling some chills in itself. That's not COVID. That's your body's immune response. It's teaching your body how to fight off the virus if you were ever exposed to it. Now, there are those so-called in the future, once you are fully immunized and you are exposed to the virus, those very rare cases of what are known as that, quote, breakthrough case. Those are the stories you hear in the news. The vaccines, Pfizer and Moderna, for example, are almost 95% effective at preventing you from getting infected. But there are still those occasional cases that do happen, and when they do, those folks most likely are not ending up in the hospital, as Dr. Lane Davies mentioned, and not dying. So it is expected to have some cases, even those who are fully vaccinated, but they are rare. And it's always thinking about out of a million. It's so easy to tell the story on the news because that's how we talk as human beings. We tell stories. It's very difficult for us to then think about, well, that's only one case out of millions, for example. And so that context, I think, is very important.
Dr. Jackson, does a mask prevent you from spreading, or does the mask protect you, or is it both?
It's twofold. It does both. If you are unvaccinated and you contract the virus, you're less likely to spread it as much with the mask. As the kids go back to school and they're unable to be vaccinated based on their age, they're being protected as they wear the mask in class from being able to contract it. So it's twofold. You don't want to pass it, and you don't want to come in contact with someone who has a variant and you are not vaccinated, or you could still contract it, but hopefully those symptoms would not be as significant. It is twofold, and we do need to wear them.
Absolutely, and I think that also answers the other, which is the last question in the chat, is should people wear their masks to crowded events, which are outdoors, especially if there's a lot of unmasked people at a large venue? So I think the answer, Dr. Jackson, is yes.
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 And if you're outdoors, obviously you can distance yourself as well. So.
Absolutely. So we want to give some final thoughts. I do want to begin with Dr. Nettleton. If you can just give us a final thought.
Sure.
Briefly.
Well, I think these conversations are really important. As I mentioned before, those questions are normal. Go ahead and ask those questions and seek out those trusted resources. They're all that noise on social media. between your family and your friends. So seek out those trusted resources, your pediatrician, your family doctor, your local health department, and seek out those resources online as well, such as the Centers for Disease Control and Prevention. So anybody in Kalamazoo County, or really anybody who is coming to Kalamazoo, can come get their COVID-19 shot and actually walk into the health department without an appointment from 9 a.m. to 3 p.m. Monday through Thursday. So come on down, you can receive your choice of any of the 3 vaccines.
Jackson, this is your time to talk to your peers. What you gonna say?
All I gotta say is, I know my mom did not work too hard for nothing, so I need you guys to go get the vaccine. I need the parents also to go get the vaccine, and I need everybody to go get the vaccine, because we're trying to go back in person for school.
Hey, shout out to Jackson's mama. Hey, Miss Bergen. I'm sorry, Dr. Davies.
Thanks, Stephanie. So I think the power of our community coming together, and you see that here tonight, and the fact that we've worked together to help protect our community over a long period of time. Dr. Jackson and I were residents a few years ago together, and we've all worked together very hard to ensure that this is a safe and healthy community for everyone. That's been particularly true during COVID, and so would ask you to, as Dr. Nettleson said, seek the information from those that you trust, and reach out to ensure that your family is protected and that you're protecting everyone in our community, in particularly those most vulnerable, including our children.
Dr. Jackson.
Thank you. Piggybacking on what Dr. Erin Lane Davies has said, if you are hesitant about getting the vaccine yourself or your child, as a pediatrician, I'm in the office not only to write a prescription for an ear infection, but I want to help educate you. We can sit down and go through what your fears are about this, because when we're educated, then we're better able to make the right decisions for ourselves and our family. And secondly, if you can go through benefits and risks of getting it and not getting it and feel comfortable with your decision, then so be it. But if we're just doing this because so-and-so said this may happen, and if you're looking at news reports and seeing what's really happening, you know that this is something that you must get done for you and your family. So,
One of the largest health systems in Kalamazoo is led by a black woman. The chief medical officer is a black woman. The CFO is a woman of color. So amazing and inspiring, especially when you're talking about health disparities. Denise, please share with us your final thoughts.
Thank you, Stephanie. And I think, I will just conclude and say we are here for you. We have been here for you. We continue to believe in you and invest in you. We want to keep you and your babies safe. That is our only incentive. We are not being incentivized. We're not receiving flat screen TVs. We're not being paid to be here. No one is coercing us or requiring us to do this work and to try to get to you and reach you. We are here because we know this is the only safe way that we can protect you and your babies. All of us have been vaccinated. We believe in the vaccine. We have studied the science and the research. We are trying to keep you alive, and please allow us to help you.
Tonight, Dr. Moore, we have heard from Dr. Sylvia Hicks-Fox, Dr. Kathy Jackson, Dr. Carolyn Watley, Dr. Erin Lane Davies, Nakinga Bergen, Jackson Bergen, Denise Crawford, Dr. Will Nettleton, and now we're going to have final thoughts from Dr. Cheryl Adele Dixon. Dr. Dixon.
Thank you, Stephanie. I just want to thank the panelists again, and thank you for your time, for sharing your expertise with this community. You are part of this community, you care for this community, and we are grateful. So I encourage people, if you have not seen tuned in live, to actually watch the video. And also, these are your community people. We are here for you. We are here to answer your questions. We are at Borges. We are at Ascension. We are in the community. We are at Family Health Center. We are at the medical school. We are at the health department, and we are here in your churches. So we are here to answer the questions, to help you be safe, and to be able to make informed choices about taking the vaccine for yourself and for your children. So we hope that we answered a lot of your questions, and we are here for you. Thank you. And thank you, Pastor Dr. Moore, and all of the people that put this production together at Mount Zion Baptist Church, my church. So happy. Thank you, everyone.
Once again, thank you so much for joining us tonight. You've been an awesome audience. Thank you so much for your questions, and we want to encourage you to keep the questions coming in. We have all these individuals that are willing, able, and available to answer your questions now and later. So once again, on behalf of Northside Ministry Alliance, our community, I want to thank my co-host, Stephanie Williams. Thank you so very much for coming and sharing. And all of our participants, thank you so very much. It's been a blessing to have you here. Information has been phenomenal. A lot of questions have been answered. And so we thank you once again for coming and sharing, giving of yourself and your resources to make our community better. So we're indebted to you. Once again, let us hear from you. Let us hear whether this has helped you, whether this has changed any minds. Do you need more answers? Do you need more information? But let us hear from you. You've got the screens. You've got the information. You can get in touch with us, and we can make sure that information is shared. So once again, thank you so very much for joining us, and just get ready for our community to be healthier and better. Pray with me. God, thank you now for this time. Thank you now for a healthy community. Thank you now that all of our children are well and protected as they go back to school. Thank you for health of every group, that this virus is under control, and we actually do things to protect each other. We honor you and love you in the name of Jesus. This is our service prayer. Thank you. Amen. Thank you for joining. We'll see you next time.